Hello everyone, and welcome to today's video where we will be exploring the surprising prevalence of tongue conditions and the various types that affect millions of people every day. You might think that tongue conditions are rare, but in fact, around 15.5% of the US population suffers from some form of tongue abnormality. Most of these conditions are harmless and don't require treatment, but others may need attention. Let's dive into the most common tongue conditions, their symptoms, causes, and treatment options. 1. Geographic tongue. One of the most common conditions is geographic tongue, a recurrent inflammatory disorder that causes patches to appear on the tongue surface, often with a map-like appearance. The exact cause is still unknown, but it is usually harmless. While many people with geographic tongue don't experience symptoms, some may feel burning or discomfort, especially when eating certain foods. It's important to note that food sensitivities may develop. Treatment is mainly focused on symptom management, using medications like Tylenol, antihistamines, or mouth rinses to alleviate discomfort. 2. Fissured tongue. Next, we have fissured tongue, also known as lingua plicata or scrotal tongue. This condition can actually be normal in adults, but it's often associated with several underlying conditions, including Down syndrome, psoriasis, Sjogren's syndrome, and even Melkersson-Rosenthal syndrome. Fissured tongue typically doesn't cause any major issues unless debris gets stuck in the grooves, which can lead to irritation. In most cases, simply brushing the tongue or irrigating it helps with symptom relief. 3. Black hairy tongue. Another condition that may seem unsettling is black hairy tongue, or lingua villosa nigra. This condition occurs when the papillae on the tongue become enlarged and trap bacteria, food, and debris, giving the tongue a black, hairy appearance. It's more common in individuals who use tobacco, drink alcohol, have dry mouth, poor oral hygiene, or those who've undergone radiation therapy. Certain medications, like linezolid, can also trigger this condition. Treatment involves avoiding risk factors, discontinuing the medications causing it, and gently scraping the tongue daily to remove the buildup. For atrophic glossitis, atrophic glossitis, often characterized by a smooth, glossy tongue, can be indicative of nutritional deficiencies, particularly iron or vitamin B12. This condition can make the tongue feel sore, and patients are typically encouraged to eat a bland diet and avoid spicy or acidic foods. For symptomatic relief, treatments such as viscous lidocaine, sodium bicarbonate solution, and Benadryl are often recommended. 5. Lichen planus. Moving on to lichen planus, a chronic inflammatory disorder that can appear as a white, lacy pattern on the tongue surface. If the diagnosis isn't clear, a biopsy is often needed to confirm the condition. This disorder can sometimes have symptoms, which are managed with topical and systemic corticosteroids, as well as calcineurin inhibitors. Due to its malignant potential, patients with lichen planus are often referred to specialists for further evaluation and management. 6. Other common conditions. Linea alba, a white, linear lesion on the tongue often caused by negative pressure from habits like sucking. This condition doesn't require treatment. Median rhomboid glossitis, a benign condition that appears as a red, smooth, rhomboidal lesion and is commonly associated with oral candidiasis. The underlying fungal infection is treated with antifungal medication. Oral hairy leukoplakia, typically caused by Epstein-Barr virus, EBV. This condition appears as white patches on both sides of the tongue and is more common in individuals with weakened immune systems, such as those living with HIV. Oral antivirals can help manage this condition. Benign growths. Some individuals may develop benign growths on their tongues, which include lingual thyroid. This smooth mass typically appears in the midline of the posterior tongue. It's usually not removed unless it causes airway issues, but care should be taken during removal as it could affect thyroid function. Oral papilloma, caused by HPV. These growths can be removed through cryotherapy, surgical excision, or laser ablation. Traumatic fibroma. This occurs due to injury or chronic irritation and is typically smaller than 1 centimeter. Though benign, an excisional biopsy is recommended to rule out malignancy. Malignant or potentially malignant growth. Certain conditions may be signs of more serious issues. For example, leukoplakia and erythroplakia. These white or red plaques can indicate potential cancer, particularly when linked to tobacco and alcohol use. A biopsy is necessary for diagnosis. Squamous cell carcinoma. This is the most common form of oral cancer, and risk factors include age, tobacco use, alcohol, and HPV. Again, a biopsy is needed for a definitive diagnosis. Other conditions. Ankyloglossia, tongue woody. While controversial, frenotomy, a procedure to cut the frenulum, has shown improvement in breastfeeding and speech articulation in younger children. Burning mouth syndrome. Most common in peri- and postmenopausal women, the exact cause is unclear. Symptom relief may come from medications such as gabapentin, topical clonazepam, or even capsaicin. Conclusion. As we've seen, there are a variety of tongue conditions that can affect a significant portion of the population. While most are harmless and don't require extensive treatment, some conditions, particularly those linked to cancer, demand prompt medical attention. If you notice any changes to your tongue or experience symptoms like pain, discomfort, or unusual growths, it's essential to consult a healthcare provider.